March is Colorectal Cancer Awareness Month, and for the next couple of minutes, some of the information we'll be talking about could save your life or save the life of someone you love. We're going to talk about screening, what screening does to increase the chances of preventing colorectal cancer. And with us is Associate Professor of Medicine and Medical Director of Quality for the Northwestern Medicine Digestive Health Center, Dr. Rajesh Keswani. Dr. Keswani, good morning and welcome to the program.
Thank you so much for having me and talking about this important topic today.
Let's talk about the symptoms and risk factors associated with colorectal cancer. Then we'll get into some of the options for colon cancer screening. But some of the risk factors and some of the symptoms that we need to be aware of.
So I think it's important to understand the risk factors for colon cancer. The first thing to think about is that everyone is at risk for colon cancer. It is a very common cancer. Unfortunately, it is the second most common cause of cancer death. So although there are risk factors that put you at higher risk, everyone should consider themselves at risk for colon cancer. But the things that we think about that put you at higher risk are a family history of colon cancer and sometimes other cancers that are associated with colon cancer, such as kidney cancer and uterine cancer. These can put you at higher risk for colon cancer in the family. And then although we all are at risk for colon cancer, there are symptoms that may suggest colon cancer, things like blood in the stool, a change in bowel habits, pain in the abdomen. These sort of things may suggest that something's going on that you want to get earlier attention with your doctor to ensure that nothing is occurring that is suspicious for colon cancer.
We're moving rather quickly this morning, but there are options for colon cancer screening. We see a lot of marketing, mass marketing on the stool tests, and perhaps you could talk to us a little bit about how the stool tests differ from a colonoscopy.
That's a great question, Ed, and it's hard as a patient to put this all together, I think, sometimes. The way I explain it to my patients is there are two main options for colon cancer prevention and screening. One is colonoscopy, which is the only test that can detect and remove most precancerous polyps before they turn into cancer. And this is what I recommend to my patients if they're willing to undergo sort of the optimal test for colon cancer prevention. But there's a lot of interest in stool-based testing because of a reluctance to undergo colonoscopy. Stool-based testing is very, very good at detecting early colon cancer, but is less good at detecting the polyps that can turn into cancer. And so if I'm recommending the test that's best preventive of colon cancer, I recommend colonoscopy. But in patients who are unwilling to undergo colonoscopy, it's important to offer them options. And the other option really at this point is stool-based testing.
I know that when you talk about that is as well said. I've never heard it said quite as distinctly as that. Is the stool tests are not going to find the polyps, and of course, once you're doing the colonoscopy, then you're already there. You can take care of any problem that comes up. What are some of the questions that you should ask your physician once you set up a colonoscopy or if you're getting one?
I think it's important to understand that not all colonoscopy is equal. This is very much dependent on the provider. And so I encourage my patients and people I talk to ask their gastroenterologist or colonoscopist, how high quality of exam are they performing? How often are they finding colon polyps during a colonoscopy? How often do they get to the end of the colon during their colonoscopy? These quality metrics, they actually represent the best evidence we have as a profession for high quality colonoscopy. So your gastroenterologist or provider should be finding polyps at least 25% of the time during a colonoscopy. And if they're not, they're probably not performing the optimal colonoscopy exam. And so I think sometimes just bringing up these questions with your provider not in a confrontational manner, but more of I just want to make sure I'm doing the best for my health, shows a commitment that you're having towards your health. And if your provider can't give you answers that seem reasonable, I think that it's important to figure out why, because all of us should be tracking these metrics if we're performing colonoscopy so that we can ensure that we're giving our patients the best quality exams.
I wish we had more time. We just have a couple more minutes left. When should screening for colorectal cancer begin? When do you recommend it begins for patients?
Again, you highlighted the importance of family history. If you have a family history of colon cancer, we recommend age 40 or 10 years before that first degree relative had colon cancer. But for the average risk patient, there's actually a little bit of debate out there right now. The general recommendation has always been age 50 for the average risk patient, although the American Cancer Society has discussed bringing that up to age 45 because we're seeing colon cancer develop at a bit of a younger age now. And so this is, again, where it's important to have an individualized discussion with your primary care provider. But in general, we still recommend age 50.
Well, there are a couple more things I wanted to get to, and hopefully we can have you back. We can talk about some of the treatment options and also some other things about people that are getting screened for colorectal cancer. But if anything we've talked about for the last couple of minutes, and someone listening says, you know, I need more information, where can we go for more information?
So at our website at dhc.nm.org in Northwestern Medicine, we've tried to put a lot of patient-facing information to help you understand how to get treated and prevent colon cancer, sort of the gamut of questions from prevention towards advanced treatments of colon cancers. So we'd be happy to have you join us there.
Okay, and again, very quickly, that website?
dhc.nm.org.
Dr. Keswani, thank you for your time this morning, and informative, and we appreciate it. Thank you very much.
Well, thanks for having me and bringing attention to this topic.